So, Tony, you are the new Chief Executive Officer here at Algoma Public Health, correct?
That's right. I commenced my role August 31st, and so we're moving into about week 3, and things are rolling along quite well. The staff have been very welcoming, and I've been able to get out and meet the mayor and also Mayor Sault Ste. Marie, I should say, and Minister Orzetti, and met with the hospital chief as well. So I'm starting to get orientated to the services within the community and reaching out to make sure that Algoma Health Public is meeting the needs of the community.
So, what brought you to Sault Ste. Marie, and what do you bring to this board here?
Well, what brought me to Sault Ste. Marie, I worked in Sault Ste. Marie for about 25 years, and then I moved down to Sarnia, Ontario to become president of Lambton College, and served my 10 years there. And we have children and a grandchild here, and it's a great area to live in, so we gravitated back to where our family is and to an area that we enjoyed quite thoroughly before we moved to the south. I think what I bring to the table is over 25 years of executive experience. Also, my education at the post-grad level is in governance and executive leadership. And so been working with this board and building on the work that Dr. Sutcliffe and Sandra Leclerc already started in terms of updating board policies, making sure we're more transparent and accountable to our community, and also ensuring our strategic plan is getting actioned. And again, within that plan, making sure the services that we are providing are the ones that are needed and they are being delivered effectively. And I have to say, my first read of this is that our staff have done, the frontline staff have done an excellent job of providing those services through the changes at the top and through the changes of the board.
Now, there are still a few things that you hope to see accomplished over the next little while. It was discussed briefly tonight that there are you're still looking for a few board members. The search is still continuing for a permanent medical officer of health.
Yes, absolutely. Our goal over the next year is to recruit a permanent medical officer of health / CEO. I am here for 12 months to bring some stability to the organization as well as leadership. And we have the services of Dr. Penny Sutcliffe as the acting MOH. But Dr. Sutcliffe and I are very actively looking at ways to attract a new MOH here on a permanent basis. It is a challenging job to do because there is a shortage of MOHs across this province right now, so we are competing in that regard. So we're not only trying to sell the Algoma Health Unit and the great programs and staff that it has, but also the community of Sault Ste. Marie and the excellent medical facilities within this community.
Is there a specific timeline to develop this plan or to try to attract somebody here, or is this just something you're more or less monitoring on a continuous basis?
It's an active plan right now. We're using Dr. Sutcliffe's network within the medical officers of health, not only in Ontario but across the country. And we're working with associations of public health across the country to make known that the position is available. We're also working with the Northern Ontario School of Medicine and looking hopefully to at least entice or attract a grad that would come out of that program in the spring.
So what do you hope to see in the next, say, 6 months down the road, perhaps in the year that you will have already been here? What do you hope to see accomplished?
Well, I hope to see our programs continue to be delivered effectively. You've heard about some new programs tonight. Healthy Babies, we'll be looking at a smoking cessation program to help folks stop smoking. We have our flu immunization program coming up very shortly, and we'll continue our inspection programs and health promotion programs. We're looking at programs around children developing healthy lifestyles to avoid obesity. So those are some right off the top that we'll be concentrating on in the foreseeable future.
It was briefly mentioned tonight. There is work being done on a code of conduct that will be further discussed next month. Are you able to comment on that at all?
Well, the code of conduct is every board, regardless of what sector you're in, that has a code of conduct. Our code of conduct at this board is a little outdated, so we'll be looking at that policy as well as many other policies, again, to reflect best practices in governance as we know them today. And that's an area where I can bring some expertise to the table with. So this board, although small, is very committed to ensuring that it is following the best standards on governance, and we are addressing the recommendations that came out of Mr. Scott's report, and one of those was concerning updating board policies, board bylaws, and ensuring that they are compliant with government regulations, but also best practices.